The 10 most depressed states. In recent years, the prevalence of depression has been on the rise across various states in the United States. The impact of this mental health condition is significant, affecting approximately 1 in 5 American adults. Furthermore, data indicates that depression symptoms are more prevalent among young adults and women. According to the latest survey data collected through the Behavior Risk Factor Surveillance System administered by the CDC, the share of U.S. adults who have ever been diagnosed with depression reached its highest point in 2021 since comparative data collection began in 2011. The median prevalence estimate for 2021 indicates that about 21% of the U.S. adult population has been diagnosed with a form of depression at some point in their lives. Here are the 10 most depressed states in the U.S., highlighting the challenges faced by their residents and emphasizing the critical need for comprehensive mental health support. Number 1. West Virginia, 29%. In 2020, a shocking new study revealed that over a quarter of people in West Virginia reported a lifetime diagnosis of depression. The state stands out as the most depressed compared to Hawaii, where just 12.7% of the population reported having been diagnosed with depression. The Centers for Disease Control and Prevention, CDC, released this alarming data, highlighting the significant geographical disparity in depression prevalence among American adults. The report notes that the Appalachian and southern Mississippi Valley regions have the highest state and county estimates of depression, indicating the need for targeted resource allocation to address this pressing issue. Number 2. Kentucky, 27.6%. Kentucky, often associated with its vibrant bourbon and horse culture, unfortunately, ranks as one of the unhappiest places to live in the United States. A study conducted by sleep experts Amerisleep identified 17 factors influencing happiness, including mental health, income, and environment. In terms of mental well-being, 1 in 4 respondents from Kentucky reported having been diagnosed with depression at some point in their lives, reflecting the challenges faced by its residents. Number 3. Vermont, 26.6%. In Vermont, approximately 104,000 adults are living with a mental health condition. A significant number of adults in the state reported symptoms of anxiety or depression in February 2021, reaching 36.2%. Furthermore, 20% of individuals requiring counseling or therapy were unable to access it, underscoring the accessibility gaps in mental health services. With 27,000 adults living with a serious mental illness, Vermont faces considerable challenges in providing adequate support for its population. In 2020, 125 lives were lost to suicide, and 26,000 adults experienced thoughts of suicide, emphasizing the urgent need for comprehensive mental health initiatives. Number 4. Tennessee, 26%. The 2023 Tennessee Child Health Poll, released during National Mental Health Awareness Month, reveals that approximately 29% of Tennessee parents express concern that their children may have undiagnosed anxiety or depression. This alarming figure highlights the pervasive impact of mental health challenges on the younger generation, necessitating increased awareness, early intervention, and support systems. Number 5. Arkansas, 25.4%. In Arkansas, the burden of mental health issues is evident, with 40% of adults reporting symptoms of anxiety or depression in February 2021. Shockingly, 25% of individuals requiring counseling or therapy were unable to access these essential services. The state is home to 125,000 adults with serious mental illnesses, and 35,000 individuals between the ages of 12 and 17 suffer from depression. Unfortunately, due to cost-related barriers, a significant portion of the population, 49.5% of those in need, did not receive the necessary mental health care. This highlights the need for improved affordability and accessibility to mental health resources in Arkansas. Number 6. Oregon, 25.3%. For several consecutive years, Oregon has struggled with mental health challenges, consistently ranking among the states with the highest prevalence of mental illness. In a report by Mental Health America, Oregon ranked nearly last, surpassed only by Kansas. The report highlighted the state's high rates of self-reported mental illness, substance abuse, and suicidal thoughts. Although access to mental health care in Oregon is average, the sheer number of people in need of support stands out. The state holds the unfortunate distinction of having the worst prevalence of mental illness in the country. This emphasizes the urgent need for comprehensive mental health services and initiatives to address the underlying issues contributing to the crisis. Number 7. Maine, 25.3%. Maine, located in the northeastern region of the country, also faces significant mental health challenges. While specific data on the prevalence of depression is not available, the state has consistently struggled with limited access to mental health care services. Rural areas in particular grapple with shortages of mental health professionals, leaving many residents underserved. Addressing this issue requires a comprehensive approach that focuses on improving access, promoting awareness, and expanding mental health resources in Maine. Number 8. Louisiana, 25.1%. In Louisiana, mental health conditions affect a substantial portion of the population, with approximately 715,000 adults living with such conditions. Among adolescents between the ages of 12 and 17, an estimated 44,000 individuals experience depression. In February 2021, nearly half of adults in Louisiana reported symptoms of anxiety or depression, further underscoring the urgency of the mental health crisis. However, access to mental health care remains a challenge due to factors such as lack of insurance coverage and stigma surrounding mental illness. With a significant percentage of the population unable to afford or access proper care, Louisiana must prioritize mental health support and ensure that resources are readily available to those in need. Number 9. New Hampshire, 25.1%. New Hampshire grapples with mental health challenges, as demonstrated by the high percentage of adults experiencing symptoms of anxiety or depression. In February 2021, 37.7% of adults reported such symptoms, and a concerning 17% were unable to receive necessary counseling or therapy. The state also records a significant number of adults living with serious mental illnesses, reaching 57,000 individuals. Tragically, in New Hampshire, 279 lives were lost to suicide in a single year, and 53,000 adults reported thoughts of suicide. These distressing statistics highlight the pressing need for comprehensive mental health support and suicide prevention initiatives. Number 10. Indiana, 25%. Indiana faces its share of mental health challenges, with a significant percentage of adults experiencing symptoms of anxiety or depression. In February 2021, 38.5% of adults reported such symptoms, and 19.2% were unable to access counseling or therapy. The state is home to 264,000 adults living with serious mental illnesses. Way forward, a multifaceted approach. Efforts to combat the mental health crisis in the United States are underway, recognizing the urgent need for comprehensive mental health care and support systems. The establishment of the 988 helpline, a dedicated mental health crisis line, is a significant step forward in providing immediate assistance and support to those in need. Since its launch in the summer of 2022, the helpline has already received over 2 million calls, texts, or messages, emphasizing the high demand for mental health services. However, addressing the mental health crisis requires a multifaceted approach that encompasses various aspects. First and foremost, improving access to mental health care services is crucial. This includes increasing the availability and affordability of treatment options, as well as prioritizing early intervention and prevention strategies. Collaborative efforts between policymakers, healthcare professionals, and communities are essential in creating comprehensive mental health support systems that meet the diverse needs of individuals. Reducing the stigma surrounding mental illness is another vital component of addressing the crisis. By promoting public awareness and education, we can foster understanding, empathy, and acceptance, creating a supportive environment for individuals seeking help. Investments in mental health research and innovation are equally important. Advancements in our understanding of mental health disorders, the development of evidence-based treatments, and the promotion of early detection and prevention strategies are crucial to making significant strides in improving the mental well-being of individuals across the nation. By adopting a multifaceted approach, we can work towards improving mental well-being and addressing the challenges of addiction, anxiety disorders, and depressive disorders. Enhance your knowledge, stay updated, and participate in insightful discussions by subscribing to our channel. By prioritizing mental health, reducing stigma, and investing in prevention and treatment, we can work towards a future where individuals struggling with depression receive the support they need to lead fulfilling and productive lives. Thank you for watching this video. Please don't forget to subscribe and turn on the notification bell.